How effective is TMS for depression?
So if you look at the meta-analysis, the old ones in 2012 were pretty weak, but I kind of wonder how much the statistical kind of significance of that was. Most of the meta-analysis that you see now, I mean, you can look in anywhere from a range of 30 to the high 60s. If you look at the manufacturers of the TMS, they always have high amounts.
Yeah.
I kind of throw those to the side. And so in general, high 60s is usually what we see as far as a response rate for major depressive disorder, refractory, which means failing one med or one modality and having major depression disorder. And like I said, we've had, this is why we're publishing, is because we've had an 83% success rate with TMS. And it's just huge with our bilateral approach, and also we use different waveforms. So we use I use both the normal 10 hertz as well as the theta bursts. And so we use these concomitantly.
Okay.
Yeah, I don't just do, I know it makes probably more business sense to just do theta, but I think that the best efficacy is using two different waveforms and basing it on the patient's symptoms and also their EEG.
Well, that goes right to what you were just saying about meeting the client where they're at, right? Because you are running those EEGs, you can see those things, can't you?
Yeah, not everybody gets an EEG because there's a lot of things that are pretty, I mean, the majority aren't that complicated, right? And they do respond. If I start seeing that they do not respond, then we go into the EEG. Now, the ones that are in the non-FDA, like less than 18, I pretty much all of them go through EEG. So
less than 18 years old, no matter what, you're getting the EEG.
Pretty much. Now, if they really don't want to, if the parents don't want to, then I'll do the normal protocol. I do, like I said, I meet the patient where they're at. There's no dictation, but I really strongly recommend this because it can dictate where we're going to go with this, because it really does help me. Because the biggest thing, there's four main waveforms, right? There's a lot more. There's gamma too, but we can't really touch that, right? And so when you talk about a theta, a delta, an alpha, and a beta, alpha is that 10 hertz. Alpha is prayer, meditation. It's the quiet mind. It's the happy place that you're trying to get. But actually, if you look at what the internal structures of the brain, they usually talk to themselves in 3 to 5 hertz. And so you've got to couple this on the location on the neural network. And so this is where I think that I have seen some of the best efficacy. So you take not only the EEG, but you also take our prevailing wisdom of what we've known and some of our anecdotal kind of experience, and then we kind of couple that together.
That's fascinating, honestly. It's really fascinating.
Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS, it's life-changing. This video right here is going to help you.